You're now live on YouTube, Chair.
Okay, thank you, Gordon. Welcome to June's meeting of Rotherham CCG Board. We have a number of apologies. I think the nice weather and half term has reduced our numbers, but I think everyone deserves a bit of a break at the moment. So we are quorate, but we have apologies from Wendy Allett, Ian Atkinson, Jason Page, David Clitheroe, Councillor Roche, Dr. DeCosta and Ben Atkinson. Anderson. Yeah. So we are quorate. Are there any declarations of interest? The prescribing incentive scheme is not for a decision, but we have to reflect that the GPs, it is about GPs pay. But we're not expected to make a decision. It is just an update about what's happening. So we'll just continue with me chairing during that bit. If that's okay with you, John. Yeah.
Okay. Yes, Chairman.
So, conflicts of interest lead, I better just check. Do we have any patient or public questions?
No, we've not received any.
Okay, thank you. Move on to the draft minutes of the last meeting then. For accuracy and anything that hasn't come up on the action log. Page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and congratulations Lindsley for not having 13 pages on the minutes. So page 14 was just to make sure we didn't have an unlucky set of minutes. Thank you then, Lindsay, they're an accurate record. Just go on to the rather impressive looking action log because everything is green. I don't think there's anything therefore we need to comment on unless Chris has anything to feed back on. No. In which case, moving straight on to the Chief Officer's report then, Chris.
Thank you, Chair. Good afternoon, everybody. So just a quick update on the Chief Officer's report. I'll just go through a couple of items and then open up for any questions or queries. So the first item is just an update on our deep vein thrombosis pathway, or the DVT pathway as we refer to it. There's been an adjustment. I'll just read out just for completeness. So the CCG have reviewed the pathway in Rotherham and amended the local enhanced service, which is how we commission services from general practice, and to increase the number of patients who can have a DVT ruled out within their surgery rather than having to go to a hospital-based service. A patient with a suspected DVT who presents at the practice will have a well score undertaken, and if the score is low risk, a D-dimer can now be undertaken in general practice, as the majority of patients are negative and require no further investigation. If the D-dimer is positive, the patient will be sent to the hospital for more tests, and it's hoped the majority of practice will choose to undertake the local enhanced service to enable an equitable service across Rotherham. So hopefully that should make those services a lot more accessible across our 31 sites in 30 practices now in Rotherham, rather than having to go to the hospital as a default. So hopefully that should improve access. The second item is a Marie Curie report called No Time to Wait, which is about fast-track continuing healthcare packages. And what this does, hopefully, will give the board some assurance about how we compare in comparison to other areas. The report's attached for everyone to look at if you wish to look at the detail. And on page 22, our CCG is shown as one of the highest performing CCGs in England based on the non-delivery rate for fast-track CHC packages. But the details there if people should wish to look at it. Just on the comms update, just to finish off then. So we've finished the first anniversary of our mental health support Rotherhive package, which has been a great success, with over 1.3 million visits in the first year. And it continues to be developed by the CCG. We've managed to reach 15.5% of the Rotherham adult population And hopefully this is something that'll be a real cornerstone of our mental health support services going forward. The vaccine programme, which obviously we've talked about at length at this meeting, is going in really well, and we're currently in the 30-year-old adults. We've done many in the 18 to 30 category as well, and we should meet all the government timescales and deadlines, and hopefully we'll be able to do a little bit quicker if possible. But we'll keep going to work through with partners just to communicate that through. I'll stop there and see if there's any questions.
Okay, any questions for Chris? Any comments? Just think on terms of the vaccination, we're at a point now where it's if anybody knows anybody who hasn't been vaccinated, we need to strongly encourage them to step forward, because we have the capacity to deliver it, don't we? And we just need to identify those people who might be reluctant in any way, just from isolating themselves and things, just to get them forward to get their vaccines done. We did I supervised a pop-up clinic a couple of weekends ago, just down in Eastwood, which was very successful. So just need to keep doing that. Anything else for Chris? No? Well, it's a bit of your show. You and Sue are
that's okay, Charles. I'll keep going if that's okay.
So, item 8 and 9 just flow into each other. So I'll just
they do. I'll do them. I'll do them together. So the first is the integrating care system update. So when we say integrating care system, referring to the development of the South Yorkshire and Bassetlaw integrating care system, which is proposed to become statutory on the 1st of April 2022. And the reason it's a verbal item this time is because we haven't received any further documents. So the update is there is no update. The documents that I think we're informed informally that the legislation is scheduled to go to Parliament in July now. So we'd expect the documents to all come through as part of that first and second reading in Parliament. So the expectation is currently we'll get a suite of documents in July. So that's really the update, and that's why there's no papers today, because none have been published. I'll leave it on as a standing item if I may, though, Chair, so I can continue just to update governing body what we're expecting, even if it's not arrived. Just keeping going on to the Rotherham Place plan. Again, this is a verbal update today. There's just a couple of things to update on. So the Rotherham Place board met this morning. The Rotherham Place plan, the health and social care place plan, is being refreshed currently, so that's updating our priorities. Obviously with a post-COVID lens. The intention is for that to go to our July place board, so it would come to our governing body in the next chronological board meeting after that place board on July the 7th. That's the place health and social care place plan. We're also going through a place development matrix, so as we move into an integrated care system, we'll be required to go assess ourselves against a place development matrix, and we'll be completing a development plan to ensure the Rotherham Place is in a position to take on maximum delegation to ensure we have local decision making for local services. The expectation is the development plan will also go to the July the 7th place board, and again that would come to this governing body in the next available meeting after that. The only other thing to update on is we're refreshing a Rotherham Place-based agreement to ensure all partners are fully signed up to delivering our plan and make sure we're all working to the same values, principles and objectives. Again, that'll be on the same timeline. So I would expect if we have an August meeting, Chair, it will come to the August meeting, otherwise it would be the September meeting if we don't meet in August. So that'll be the Rotherham Health and Social Care Place plan, the development plan for the Rotherham Place against the assessment matrix, and also the Rotherham Place agreement.
Okay, thank you, Chris. Any questions or comments for Chris? No. Yeah, there's a great amount of work being done in the background, isn't there, by the team. It's a good sign of how mature we are in Rotherham that actually is going quite smoothly. But we'll save all the excitement to when the papers arrive.
Yeah, I think so. I think there is a lot of work being done. Everything's on track, going to plan, and we would expect the Rotherham Place to go through some sort of assurance process in the September to March period as we move into an integrated care system. So it feels at the moment that all our plans are in place and are developing as we'd wish. But obviously, governing body members can be the judge of that when you receive the documents in August or September, depending when we meet.
Okay, thanks, Chris. Okay, it doesn't look like the presenter of our next item is actually here. So we'll move straight on to item 11. So Joanne, would you like to do the finance and contracting report?
Yes, thank you, Chair. It's a pretty straightforward report this month. It's early in the year, so there's limited data available to report on. But just to recap, the financial plan that Wendy brought to governing body last month was for a 6-month period, April to September, known nationally as H1 or half one. So the report today is for April, the first month of that 6-month period. And just working through the report, section 2 and 3 shows that we're managing cash well and paying 100% of invoices on time in line with national requirements. Section 5, the operating cost statement, we're showing a break-even position across all areas of spend, both at month 1 and forecast for H1. And again, the main reason being there's either limited data or no data available for this period. And for that reason, the risks are listed at section 13 are the same that we included in the financial plan, and those will be updated as more data comes through. So we're asking governing body today to just note the position, i.e. limited data, but we do expect to meet our requirements to have a balanced position at the end of H1. And that's all I really wanted to say, Chair.
Any questions? John, you've come off mute, but I don't know whether that's, yeah, John.
Well, I haven't really got any questions, Joe, about the actual month 1 report because it all seems to be in line with the plan, and the risk analysis looks okay at the moment, doesn't it, as well? But I did just want to check where we are in terms of the annual accounts, because we're due to have the sign-off meetings next week with Audit Committee and Governing Body. So could you just give us an update on where we've got to in terms of the audit review of the annual accounts, please?
I can, yeah. So Matt met with Audit last week for the close down session. Everything looks fine and on track. And I think you've probably received the papers for Aqua and the extraordinary governing body next week. So all on track to sign off hopefully next week.
Oh, sorry to ask the question then, Joe, but I've not actually, I don't think we've received the papers yet, but they must be on the way, yeah.
There will be, yeah.
Thank you.
Thank you.
Okay. Thanks, Joe. Any other questions for Joe? Okay, we're moving then on to delivery dashboard for 1 month only. Sue is going to be in.
Thank you, Chair. Let me just find my document. So thank you. This does have my name against it on the agenda. However, as you said, it is Ian's paper, and I'll mention some highlights and take questions. Any that I can't respond to, I'll take back for Ian to feedback at next month's meeting, if that's okay. So the first table it shows the overall position for cancer, improving access to psychological therapies, or IAPT, as we call it for short, diagnostics and referral to treatment. The areas of concern remain cancer 62-week waits and referral to treatment, which are both improving diagnostics, which showing a deterioration of the previous month's position, but still staying around the national position. The position for the cancer 2-week waits continues to improve, with both of the indicators exceeding trajectory. And I think in line with what we're seeing across South Yorkshire and wider, A&E attendance remains above last year's level and is increasing. at the moment. It does seem to be a much wider picture. And the IAPS information, self-referral into IAPS is now well established and contributes to the positive position, which is well above the standard for 6 weeks and consistently achieving the standard for 18 weeks. And the focus on section looks at the detail under referral to treatment incomplete pathway data. And you can see there's been consistent improvement from July last year through to April this year. They were the highlights that I picked out.
Okay, thanks, Sue. Have we got any questions? Debbie?
It's quite, I think, hopefully it's a straightforward one. Sue, I know with the A&E weights, we're comparing it to last March, but of course that was a strange time. If we were able to look at the previous year to that, which perhaps it's more of a sort of a calibration, a more direct calibration, I know it's increasing, but is it above where it was in March, what would have been 2019, wouldn't it? Or
we're about back to pre-COVID levels with A&E attendances, I would
right,
say.
So it's gone back up to where it would be on a, I don't want to say normal, but on a year.
Pre-COVID levels, yeah.
So it's not going above that at the moment, but
it's not above that. It's around about, I think it's still slightly below, happy to be corrected, but it is round about pre-COVID levels.
Okay. Because obviously,
and I think others are seeing that across the region as well.
Yeah, because I think that's more of an indicator, isn't it? If we've got an increasingly bulge coming through, we need to be careful, don't we, really?
Yeah.
It's I suppose in one way it's good that patients have got the confidence now to approach, but it's like you said, it's getting people the right services at the right time, isn't it? So, okay, thank you.
Okay, Chris, your hand's up as well.
Yeah, thanks. It's just a question. It's really just a statement rather than a question about system pressures. So there's definitely something changed in our system. It's a national issue, but we're definitely feeling it across South Yorkshire and Rotherham. And the early stats are saying that general practice is seeing an increase of 20 to 30% in demand. We're seeing a similar impact in our A&E department and also in terms of our mental health services as well. And I'm sure there are many other areas that I haven't mentioned. But just to be aware is there's something definitely changed in our system and we are under extreme pressure. I think the challenge for us now is to find a new normal. Some patients prefer face-to-face contacts. Some are very happy with non-face-to-face contacts. And we need to find a balance between face-to-face and non-face-to-face and try to find a way to meet the demand. We don't know if it's pent-up demand or this is the new normal. We just don't fully understand it yet. So that's a challenge for us all as a system to work through.
Okay, thank you. Any other questions for Sue? Okay. Right, Stuart was in the waiting room and now he's gone. So whether he thinks he couldn't get in, I was just not wanting to get him in the middle of a conversation. So we'll keep moving forwards. Sue, patient safety and quality assurance report. Oh no, stop. We'll go back to Stuart's. We'll give you a pause. He's come back in. Just wait for Stuart to join us. Are you there, Stuart?
I'm here, yes. Hi everyone. Sorry, I hadn't got a link in my diary. So it's the prescribing incentive scheme that I'm
That's great.
having to discuss. Okay. So in summary, we set a prescribing incentive scheme every year. The format, the scheme changed slightly last year. So the money for this scheme has already been in the financial plan and it's already been allocated. So we're not asking for funding or the like because that's already been agreed in the financial plan. The scheme here is just to identify how we're going to run the scheme this year. So previously we've always set the prescribing incentive scheme partly against performance against practice budgets and managing prescribing within the practice budget. Last year, because we didn't set any practice budgets and we're not going to be setting practice budgets for the first 6 months of this year, maybe for the whole of the year, we've divorced the scheme from the practice from practice budget performance. It's run over 13 individual criteria, which are included in there, and practices can get up to 10 pence per patient for each criteria that they achieve. We usually get about 65 to 70% achievement rate on the whole of the prescribing incentive scheme. Other areas running inside and prescribing incentive schemes, Barnsley and Sheffield have, they have more extensive schemes, as does Wakefield. Doncaster and Bassetlaw did not have an incentive scheme. So we're certainly within the pack with having a scheme. And it's really here for governing bodies' approval of the criteria that we've set in refreshing the scheme for this financial year in 2021-22. The scheme's already been through the Medicines Management Committee, OE, and the LMC have already had sight of it as well. So any questions?
Okay, I'm going to stay fairly silent as GPs we have a conflict of interest. Chris.
Yeah, I mean, just to say, this is something which we've established over many years, Stuart, isn't it? And it's something that has delivered great success for us. So we're keen to maintain it. The challenge is making sure we're focusing on the right areas each year. I think as we've been through the process, we're happy. However, I'm sure if something came up in the new uncertain COVID world we would obviously look to review it for future years as well, wouldn't we, to make sure it's fully flexible. But it's something that I'm happy with it as it stands, Chair.
Okay, Janet.
Just to say as well, Chair, it came to the Primary Care Committee last month, and there were no issues raised there either.
Did you, Janet? I forgot that one. Sorry.
Yeah.
Oh, could you forget Janet?
Not Janet, the Primary Care Committee.
Right. Okay. So we're basically being just asked to note this because this is already part of our plans. It was an update. Is everyone happy to note this? I'm looking for nods from the lay members, obviously with our conflict of interest. That's great. Thank you then, Stuart.
Okay. I'll go back to Armagh.
Yeah.
Bye everyone. Thank you.
Okay. You almost got a chance before, Sue, to go into patient safety and quality, and you can now.
Okay, thank you, Chair. The report starts as usual with infection prevention and control information from across the patch. The trajectories for C. diff, as I've mentioned before, have been set locally, and we based them on last year's trajectories, which were also based on pre-COVID trajectories, as we haven't received national targets, and we have an inbuilt need to work away from rising numbers and have something to base that on. The CCG inputs into local outbreak processes via our infection prevention and control nurse, who's engaged in all incident management meetings. And moving on, TRFT continued to monitor all mortality data closely. And while there was a fall for 3 consecutive months, this hasn't been sustained, and it remains a challenge to accurately reflect the effects of COVID on this. The Trust have established new processes and increased medical examiner input into providing robust reviews of all deaths and data. This was something that was discussed in detail as part of the quality risk profile process that we've recently undertaken with the Trust and NHS England, and this continues to be monitored through contract quality and through the NHS England quality risk profile process as well. The safeguarding event for GP practices was held in May with over 800 delegates registered to attend. The theme was a lifelong legacy and the effects of adverse childhood experiences throughout your life, how that can affect people throughout their life. Also in the safeguarding section, there are included snapshots of information shared with GP practices. And just to mention, the South Yorkshire Violence Reduction Unit are launching a campaign to encourage anyone experiencing domestic abuse to access help and support. There are links to animations sharing people's lived experiences around domestic abuse within this month's report. And the domestic abuse bill became legislation in April this year and is intended to further provide protection to those who experience domestic abuse. There is a summary of that, the main points of that bill on page 7 of this report. The Alan Wood review of multi-agency safeguarding arrangements has been published, and the key recommendations being around developing resources to support independent scrutiny and increasing independent scrutiny in both how much of it we do and the robustness of it. There's also an acknowledgement that the NHS landscape is changing, and the review will have to extend and further look at the multi-agency safeguarding arrangements when the progress from CCGs into the ICS arrangements has been completed. And there are also links to CQC reports that have been published during the last month. They were the only things that I was going to pick up this month, Chair, and I'm happy to take questions.
Okay, questions for Sue, comments? Okay. I think clearly from the delivery dashboard with the system being under pressure, it's just a point to point out that the quality assurance bit, especially on page 17, 18, just demonstrates how we're keeping an eye on everything for anybody else listening or wanting to read. It's really, we have that check on quality while we keep pushing on waiting times and things.
And it remains a golden thread through all of the work that we do, and as I'll mention when we look at the patient experience, there have been increasing challenges in terms of maintaining that level of scrutiny over quality with the restrictions that COVID has sometimes put around us with regard to doing unannounced visits, walk rounds, taking part in things like that. We've had to be innovative in the same way with quality assurance and the way we gain and the level of assurance that we gain.
So, any other questions? That's great. Thank you very much, Sue. Continue the hard work. And
thank you.
Talk to us about patient and public engagement.
Okay, thank you again. The report starts with some service user feedback about access to mental health services. These are from a longer Health Watch document, which will hope to raise areas of concern that are important to patients and hopefully be used to inform future commissioning. There's also linked to this a patient story which highlights areas where that patient feels improvements could be made together with what they feel went well for them and an overall positive outcome. And I do think that feedback like this is really rich and useful because it covers the majority of the patient pathway and journey through to outcome. And we can look at different pinch points throughout the journey rather than looking at each section independently. It's Appendix 1, Appendix 1, there's an ICS engagement update, which was also discussed at the Engagement and Communications Committee. Conversations are also taking place with the equipment supplier to look at models for co-production for processes for equipment supply services and how these can be developed to be more inclusive of those who require medical equipment in the community. And also the volunteer support to the local COVID vaccination sites continues apace as the programme moves through second doses and expands the first dose cohort. There are around 300 volunteers working across all the sites in Rotherham and about 18,000 hours of support having been given to date. I've attached the Health Watch newsletter at Appendix 2 and I'm happy to take questions, but I did just want to ask Debbie if there was anything else she wanted to mention at this point. I know that that she has some minutes later in the agenda, but if there's anything she wanted to add.
No, I just endorse really what you said, Sue, that we're trying to keep in touch as much as we can with the patient voice and listening to patient experience, because that will help to us to inform and improve everything that we're planning to do, really. So as many of our agencies, we're working as possible, and Helen's, our communications engagement manager, has got her ear closely to the ground with a number of communities and social groups out there just to be actually listening and let them tell us what it is that works and how their ideas for improvement, because they've always been so invaluable in the past, and they will continue to be so as we go forward, really.
It's lived experience. It's the best information to get back, isn't it?
Yeah, definitely.
Okay, thank you both. Any other questions? Okay, well, moving on then. Ruth.
Thank you, Chair. So this is an update on the 2021 Workforce Race Equality Scheme with data from the staff survey and NHS jobs. There has been very little recruitment, as you can understand, this year. So the position remains virtually unchanged and that no significant issues have been identified. We're getting it earlier this year than what we have done previously, so we can meet the governor's deadline for putting it on the website in August. It went to the Equality and Diversity meeting in May, and where there was a detailed discussion around this. Aqua have also seen it and approved it for publishing on the website. So it's here for your information and to ratify the publication.
Okay, and Aqua were happy with it, John?
Yes, Chairman. I think we reviewed the analysis of key issues, and in fact there were no significant issues in there, so we were content with it. Yes, thank you.
Okay. So any other questions for Ruth? In which case, is the governing body happy to ratify this? I'm seeing yeses and thumbs up. Okay.
Thank you.
Okay, we're happy to ratify it then. Now, we'll move on then to some new policies, which Sue has volunteered saying. So this is what we've been saving all our energy for, because Sue is an expert in the IT and digital problems. So we'll just listen to you, Sue, as the expert.
Okay, yeah, there's something for you. I volunteered to do this, must have slipped my mind. Thank you. So these policies have been through I'm trying to remember the name of it, the Information Governance Committee, and the changes are highlighted in the analysis of key issues and risks. We've also, John, have these policies been to Aqua?
Yes, Sue, they have.
Thank you.
We, as you've just mentioned, really, the covering paper set out the reasons for the updates to the two policies, and they all seemed, appropriate, didn't they, in terms of agreeing the updated policy. The reasons were clear. So
just taking the Information Governance Policy and Management Framework, this is for ratification and has been through the normal governance processes, and I'll do my best to answer any questions if anybody's got any on that one.
It's a fairly self-explanatory cover paper. Has anyone got any additional questions? That's fine. So as a governing body, we're happy to ratify the Information Governance Policy. I'm seeing lots of nods, so I'll take that as we're happy to ratify that one. Then we have
and moving on, the email, digital collaboration and video conferencing policy and procedure. Again, been through the same processes, the background and the key issues there. We have reviewed in-depth and detail video conferencing around this policy as well. So again, to ratify the changes, we have changed the name of this policy. Yes, we have, and ratifying the changes made to the email policy, including the change in name. Happy to take any questions.
Okay. Questions, comments? Again, it's quite a concise and clear cover paper.
That's Claire McInnes.
Yeah. Okay, so we're happy to ratify it. Okay. So thank you, Sue, in your role. Is it digital futurist that you've decided to become?
I've decided that I'm going to be a digital futurist, yes.
Okay.
Thank you.
Okay, moving forward then, we've got the Primary Care Committee annual report. Is this with you, Janet?
Yes, thank you, Chair. This is the Primary Care Committee annual report, which details the work that was undertaken from 1st of April to the 31st of March. It went to Primary Care Committee last month and was approved. It's a detailed report of everything that's been undertaken, and I think I'm very pleased to bring it, and would actually say it shows the amount of work that's taken place, and which is impressive enough in the face of that happening in terms of a COVID pandemic is even more impressive. So I would just like to commend it and thank everyone who's been involved for the tremendous work that they've done, the tremendous effort they've put into it. And I'm happy to take any questions.
Okay, thank you, Janet. It's when you start listing everything the CCG does in just one bit of its organisation, it's amazing how much work the teams get through, isn't it?
Yeah, just incredible.
Any questions or comments? No. Okay. Well, thank you and your team for all the hard work you're doing, Janet.
I think it's thanks to all of them, really. But it's brilliant. It's really well deserved. Really excellent.
Okay. Thank you. We'll just move through the minutes from other meetings. We'll stay with you, Janet, then, because there's the Primary Care Committee.
Yeah, these are the meetings from the April meeting. Again, I'm happy to take any questions or comments. I think sort of just looking through them, the thing to, just one thing again is about the wound care local enhanced service, which has now got 100% sign up from GP practices across Rotherham, which is great. Happy to take any questions or comments.
Okay, any questions for Janet? Okay. A&E Delivery Board. Has your name against it, Sue?
I think I get the pleasure again. Thank you, Chair. So this in part answers Debbie's question from earlier in terms of looking at attendance numbers being around and at times more than pre-COVID, with the exception of the beginning of the year. Taken overall, they're around about the same. Taken month by month, we're looking at some increases there. Also, very much in this agenda in that this board looks at is flow through the hospital, not just attendance at A&E. And as we all know, there are many things that affect the flows: the continuing healthcare, the availability of beds elsewhere, the availability of beds in the hospital, and looking at alternative ways that some issues can be done. So that's also part of the agenda for this board.
Okay, thank you, Sue. Anything you want to ask about A&E Delivery Board? Okay. John Aqua.
Thanks, Chairman. Yeah, there's nothing this month that I wanted to escalate or raise with the governing body, so they're there for your information. Thank you.
Okay. Any questions? Nope. The Health Executive Group for the ICS, Chris?
Yeah, very, very similar. The papers are here for information. There's nothing I particularly highlight that we haven't already covered, but if anyone's got any questions, I'm happy to take them.
Okay, I can't see any hands up. Jeff, Members Committee?
Yeah, thanks. Same again, really. April's meetings, minutes, and again, most of the stuff sort of things that's been discussed and ongoing, unless anyone's got any questions.
Okay, again, thanks, Jeff, but there's no hands up. The last one, Debbie, Engagement and Communication.
Yeah, thank you, Chair. This came last month, and I think this is for ratification actually this month, but we were talking back in March, which is a long time ago now, about mental health and all the services that were supporting that, the vaccination volunteers, and sort of resetting. So unless anybody's got anything else to raise, this is just really for ratification today.
Okay. I think we just note these as minutes. That's fine. Thank you. There's no hands up. Okay. There is no other urgent business being raised. There's no issues or anything we need to escalate. We will have it's been a relatively short meeting, and we will be having a paper next month about during specialist transition as business begins to be moved across to other organisations, that we will reduce the frequency of the board meeting. So we'll be discussing that next month. But otherwise, thank you all. And we have to now make a decision on exclusion of the public. The representative of the press and other members of the public be excluded from the remainder of this meeting due to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest. We're all agreed on that. So therefore, I will bring an end to the public governing body and look forward to seeing you all again in July, where hopefully the weather will still be as lovely as this. Otherwise, the confidential meeting will start at 10 to 2. All right, give you a chance to have a break. Thank you, everybody.